Hello and welcome to Healthwatch. I'm your host, Carolyn Wilson from Light Health District. The goal of this program is to bring you information on a wide range of public health topics and to introduce you to the people doing great work across the community. Today, I'm joined by Asha Patel and Marie Sajaw, who are interns at Light Health District. And today, we will be talking about the Adopt a Health District intern program. Asha and Marie, welcome to the show. So I'd love to get started today by having our audience get to know the both of you. Let's start with you, Asha. Tell us a little bit about yourself.
Hi, so my name is Asha. I'm currently a senior at the University of Connecticut, and I'm an allied health sciences major with a concentration in healthcare administration and a minor in healthcare management. I'm also currently an intern at the Light Health District, working with the Adopt a Health District program to promote opioid misuse prevention.
And Marie.
Hi, similarly, my name is Marie. I'm also a student at the University of Connecticut. I am a junior though. I'm an allied health science major with a concentration in public health and a minor in women, gender, and sexuality studies. And similarly with Asha, I'm also interning at Light Health District as a part of the Adopt a Health District program that we're both a part in promoting opioid misuse prevention.
And that's great. And I do have the pleasure of working with the both of you at Light. I've been the coordinator for the internship program for a couple of years now, and I'm so thrilled to have you both. We've been having a great time. I'd like to know why the both of you wanted to do an internship at a local health district. Asha, let's start with you.
Yeah, so I've always been interested in engaging with the community and doing work with opioid misuse prevention. And I think that working with the local health department definitely helped me gain more hands-on experience in public health while also making an impact in the local community. This opportunity also allowed me to apply the knowledge that I've gained from taking classes at UConn, specifically with public health classes, into the real world.
Great, and Marie?
I mean, yeah, for me, it was also just kind of that hands-on involvement with the community, really wanting to get that outreach experience and being out in the field, learning what a health district really does and how much of an impact they have on their community, which prior to this internship, I didn't realize how much of an impact, health districts have on their communities. So it's just been a very interesting experience. And I'm just, overall, I sought it out for gaining that experience and gaining that insight and just learning more skills that would help me in this public health field.
Great. Now, tell us a little bit about the Adopt a Health District internship. What are the goals of the program? Asha, we can start with you.
Yeah, so the Adopt a Health District program, basically the goal of it is to engage us in primary prevention strategies to mitigate the state of Connecticut's opioid crisis. And we can do that by raising awareness about prescription drug misuse, the dangers of sharing medication, and the risk of overprescribing. We also want to inform and educate the local communities about healthcare practices by promoting positive health outcomes for both the individuals and communities. And I think that a couple of main goals are for us to learn about how to design, implement, and assess substance use prevention programs.
That's a lot. And Marie, do you have anything you want to add to that?
I'll just add to that by emphasizing that it's a great opportunity to become involved in your local communities and working with these local health districts, and just the overall raising awareness for opioid misuse and providing more outreach and resources opportunities and teaching us more methods to communicate and connect with these communities and have an effect that actually is the effect that these communities want by surveying and the importance of surveying and gathering public opinion.
Awesome. Now, both of you are college students. It's been a while since I've been in college, and when I do prevention work, I typically am looking at the 12 to 20 age group and, of course, their families. Being a college student does come with its own challenges. Tell me a little bit about the college experience. What are you seeing in terms of unhealthy behaviors such as substance misuse?
So, I think as a college student, you're definitely surrounded by a lot of drug and alcohol abuse. You see it all the time. I personally have only seen people use marijuana and cocaine. I mean, I feel like that's definitely really popular, especially when it comes to UConn, because we're a really big fraternity and sorority school, and that's like, pretty typical for that. I haven't seen any opioids being used. I mean, that doesn't mean it doesn't happen, but I haven't really seen much of that. I've also seen a decent amount of people misusing prescription medications like Adderall. People are usually using that even when they don't have a prescription for it. You can probably get it from one of your friends.
Right, and Marie, any other observations?
Yeah, I would add on to that with, I also haven't really seen any opioid misuse like on campus. I think it's like opioid misuse is not as popularized or normalized as like marijuana use, and even cocaine I feel like is kind of starting to get more normalized, though it's still not normalized, but it definitely is, I feel like, starting to get a lot more normalized than it used to be, and also alcohol misuse. But yeah, I haven't really seen opioids used, but Adderall, I've definitely heard and seen people using Adderall without a prescription, and I think it's becoming very normalized as well to use it as an effective study method.
Interesting. Now, you did mention cocaine, and I'll just say that, in terms of drug overdoses, we are seeing an uptick in cocaine being involved with opioid overdose because sometimes there's fentanyl in the cocaine. I know that's something that we've talked about. And I know on the public health front, we are trying to get the word out about that, the importance of testing drugs and being aware that if you think you're using a stimulant, if it's a pill or a powder and it's from an unknown source, you might not know it could have fentanyl in it, and it could lead to an opioid overdose even, without intending to. So very interesting. So that could be something that you could bring back to the college community, a little bit more awareness there. Great. So let's talk a little bit about the public and the community, what we'd like them to know about opioid safety and preventing overdose. Asha, let's start with you.
Yeah, so I think that education about opioid misuse prevention is crucial because it helps reduce addiction rates and prevent overdoses. I think that people are unaware about how quickly a development to opioid addiction can occur. It's definitely something that you wouldn't expect to happen so fast, but it's important to educate people so that they can make informed decisions about alternative pain management. I also think that it's important to destigmatize addiction. People struggling to avoid seeking help due to they struggle to avoid seeking help due to stigma, and I think that having public awareness can help reduce the stigma.
Those are great points. Now, in a little bit of a different direction, Marie, tell us a little bit about the things that you've been doing during this internship that might help promote drug safety.
I mean, we've been doing a lot of tabling and a lot of outreach kind of things. So like handing out pamphlets and informing people through, resources from like the Connecticut Clearinghouse, among other things, as well as working on informational presentations that we can disseminate to different communities, and outreach to like local pharmacies to kind of get connected with these people in our community that are very directly impacting. So just a lot of outreach, a lot of connections, and just interacting with the community in a way to spread awareness and information.
Great. Okay, I think we're going to take a quick break. Please join us back here for more Health Watch.
We all want our kids to grow up safe and healthy, so we show them how, and we tell them with honest conversations that let them know what we expect. That's especially important when it comes to alcohol and other drugs. Kids need to know the dangers and how to avoid them. And when it comes to pain medications, opioids, they need to know that they should never be taken without a prescription and never shared with friends or family. It's dangerous and illegal. So talk with your kids, because when you talk, they hear you.
I'm an ex-drug dealer, and I'll be your sub today. Two milligrams of fentanyl can be lethal. A lethal dose is in here. Who gets it, I won't know.
It's cheap, it's potent, and it's profitable.
The sad reality is, fentanyl is being mixed into everything now.
More kids should know.
Welcome back to Healthwatch. I'm your host, Carolyn Wilson, and today I'm joined by two UConn interns who are part of the Adopt a Health District internship program. Asha and Marie, welcome back. Before the break, we were talking a little bit about the internship and some of the things that you've been working on. And we're going to jump back into the conversation and talk about even more things. So we'll start with you, Asha. Tell us from your perspective, what are some of the misconceptions about naloxone, which we talk about a lot? How should people go about getting that? What are their options?
Yeah, so we've learned a lot about naloxone through this internship, and I think that one of the biggest misconceptions is that only medical professionals can administer naloxone. This is definitely not true. Anyone can do it, and it's relatively easy to get a hold of naloxone and really, really simple to administer. I also think that people think that you can overdose on naloxone, but it really can't harm you in any way. Since naloxone is not addictive, and it has no potential for overdose, it only works on people with opioids in their system, and it really has no effect on anyone if they don't have opioids in their system. You can also get naloxone in most local pharmacies, including Walgreens and CVS, and there's no prescription that's required.
Awesome. So really, there are a lot of different options for folks. You know, you can get it prescribed, you can get it over the counter, which a lot of people were waiting for a long time, and that's happened in very recently, which is great because we want a lot of access. We want it easy to get, easy to administer, and certainly the nasal spray is very simple to administer. And one of the things that we've talked about in the internship so far is the Good Samaritan law. And that is supposed to help put people's minds at ease when it comes to using an opioid overdose antidote like naloxone. People think, oh, it's a medicine, I'm scared to use it, you know, am I liable if something happens? And one of the things we really try to educate the community about is the Good Samaritan law. If you have it, use it. Don't be afraid to use it. Always call for help, but it is a medical emergency, but you know, very simple and safe to use. So that's one of the important pieces about naloxone. Now, Marie, I know that as part of this internship, you and the other interns that service different health departments across the state have learning labs. Tell us a little bit about what you learn in those labs and what's been the most interesting thing so far.
Well, the labs have been great. Dr. Rickles is an amazing instructor, and we honestly learn a lot, and it's great to really take that information that we learn in lab and kind of apply it to what we're doing at our districts. But some things that really stuck out to me is the importance of speech and the importance of using like language when talking about drug substance misuse in general, and like, you know, instead of saying misuse instead of abuse and other things like that. And I think that's just so important to know and utilize because it really helps to destigmatize substance misuse and make people feel less intimidated about, you know, seeking out resources to kind of combat that. And just also the misuse of prescription medications for the elderly population in particular, just because of the miscommunication of them taking their prescription maybe for longer than they need to, or for maybe forgetting that they already took their medication, taking it again, and things of that nature, which can lead to, can become opioid misuse. So just those things were very interesting to me, things I didn't really know about, especially the language thing. So it was really surprising because you're like, oh, I didn't realize that, but it's been very informative and really helpful into like my public health journey and learning these things.
Fabulous. Yes, Dr. Rickles is awesome. I've had the opportunity to work closely with him for the academic detailing for opioid safety program that I've told both of you about through the School of Pharmacy, which he is the dean of. And he's a great guy, and it's a great resource for you and the rest of the interns. So love that he's part of that. So let's talk a little bit about safe storage and disposal of prescription drugs. In my prevention work, I can tell you we've spent a lot of time over the last decade, even longer, talking to folks about storing things safely, disposing of them properly. Asha, what are some of the key factors of safe storage and disposal?
Yeah, so proper storage and disposal of prescription medications is really important for preventing misuse and even accidental poisoning. It's important to keep your medications secure, like storing them in a locked cabinet, definitely away from children or from anyone who might get access to them who doesn't need to. It's definitely important to keep them in a controlled temperature so that your medications stay how they need to be and don't get ruined or anything like that. We also have to stress the importance of drug take-back programs. I know we have a lot of those occurring throughout the year, and I think that that's definitely one of the best ways to dispose of unused or expired medications through these local drug take-back days.
Absolutely, and I know that we do 2 of those a year, and those holidays, observances were created by the DEA really to really promote the importance of proper disposal, and many surrounding towns have their drop boxes that are available 24/7. And I can tell you here in Groton, we've collected tons and tons over the years, literal tons of prescription medicines. Not everything is an opioid or a controlled substance, but we're starting to get people in the habit of really taking it to the box, as we call it, to make sure that they know how important that is. Because a lot of people would just flush their medications, and we know that that's not great for the environment. So we love those programs, certainly very important. Now, as a part of this internship, I always talk about how we do learning and we are also doing, and it's a combination of the two. Through this experience, if you had to pick one big take-home message that you really care about, that you think that people really need to know, what would you say that is? Marie, we'll start with you.
I guess I would say kind of driving home that point of the importance of language and how big of an impact it can really have on destigmatizing opioid misuse. So I think that is my key takeaway, and that's the key takeaway I would give back to the community to say, because it really does help.
Fabulous. And Asha, what about you?
Yeah, so I think that following prescriptions like exactly as directed is something that I think is really important. This goes along with avoiding mixing medications and just using the proper dosage that is prescribed to you by the doctor. That's something that's really important for you to follow when taking prescriptions, especially with opioids.
Great tips. Those are really important. Now, in internships, I know that, we're starting to think about careers. You're both in college. You might be thinking about grad school or what areas you want to focus on. Marie, tell us how this internship has maybe guided your career choice.
Prior to entering this internship, I was already pretty interested in the field of public health, and really this internship was like my opportunity to really dip my toes in and really experience this field. So it's been really helpful in that, and I'm definitely thinking post-grad of pursuing my master's in public health. I just really am interested in the field, and this internship has just been monumental for helping me understand that I really do want to learn more, and I do want to pursue that post-grad. And then potentially after that, going into medical school and becoming a physician. I'm not sure what field yet, but maybe gynecology or anesthesiology or something of the sort. But public health I feel like is such an important field to learn as a public health professional or even as a physician in the future, because it impacts so much of our health directly that people don't even really think about. So yeah, that's kind of where I'm thinking career goals wise.
Fabulous. Watch out, world. Love that. We talk a lot about, learning and doing. What's something that you're interested in learning a little bit more about? Asha, we'll start with you.
Yeah, so I'm definitely interested in learning about how maybe different areas of Connecticut or honestly of the country deal with things like this. We only really have experience with Connecticut and specifically New London County, and I think it'd be really interesting to learn about how different public health departments are across the state or even across the country.
Great. And Marie?
I think kind of similarly to that, but learning more about the different sectors of the health departments, because we've kind of been more focused in the one side of it, but learning more about how those different sectors impact the communities as a whole, and on a state level, how we deal with public health initiatives in general.
Fabulous. Now, to wrap things up for today, tell me something that has sort of surprised you in this experience, something you've learned or maybe some research that you've done. what has sort of been kind of a light bulb for you in this experience? Marie, we'll start with you.
Something that really surprised me, I would say, is the impact of health communities, like as a whole, not health communities, health districts, sorry, as a whole to their communities. I feel like it's just, you don't realize how much that they do when you're just like existing and living in your town, but they really put in the work and really try to get that input from the communities to see what people want done and what needs to be changed, and doing what they can with their funding to get those things done. So it's definitely been really eye-opening to me to see the true impact of like local health districts.
Great. And Asha, lastly, for you, something surprised you?
Yeah, I mean, I'd have to definitely agree with what Marie said about that. I never really realized how much effort health districts put into things like this. Like, I didn't realize that walking to the office when we do, seeing that each individual person has a role in the health department and how important what the work they do is to the community. It just kind of surprised me that there's just so much going on and that there's so much like interaction with the community and, helping everyone out and things like that.
Awesome. Well, it's been so great having you. We still have a little bit more time in our internship together, but thank you both for joining me today. This has been a real pleasure for me, and you're both such hard workers and very talented, and this has just been a pleasure. So thank you so much.
Yeah, thank you too.
And to our viewers, thank you so much for tuning in today to Health Watch. We hope you'll join us again right back here on Health Watch.